Good morning, good morning. We're going to get started in about 5 minutes. We hear there's still a line of cars out there. So just give us about 5 minutes and we'll get going. Thank you. Good morning, good morning. If everybody can be seated to standing, that'd be great. We'll get started. I was kidding with us getting a little bit started late. I said we needed that late proposal clause in the sign-up when all the contractors came in, everybody would be here at 9 o'clock, right? Yeah. So, good morning, everybody. I'm Brian Hebel, and I'm a group director in the Acquisition Support Group of OAGM. And I've actually been an OAGM team member since 1989. I was just thinking about it yesterday. I was thinking, boy, when we hit 2020, it'll be 4 centuries I've been here, over spanning 4 centuries. So I enjoy coming to work every day, working with the people in the office and working with you. And that's what today's about. It's really about you. So I'd just like to say Happy Industry Day. Happy Halloween. You know, I was thinking on dressing up in an Uncle Sam costume this morning, but I was hoping somebody from industry would do it. I don't see anybody dressed up today, so I guess that's probably a good thing, I guess. So, you know, it always amazes me about coming to work every day at CMS, and I always say, you know, our budget is about $300 billion more than the Department of Defense budget, but we only have 6,000 employees, and, you know, you guys are here today. We're in this building, and we do have some outbuildings where all that happens. So we really, it's amazing that how things get done right here in this building, and you know, we rely on contractors to do a good portion of our work. So we really need you as much as you need us for your company. So we really appreciate you being here and trying to get engaged that way. For today, we have a couple of housekeeping items that I'd like to go through about today. And here's the outline for the agenda today. We're going to have 1 hour in the morning with some of our leadership speaking. Then we're going to have a session, Tips from the Inside, and we're actually going to have 5 managers up here talking about their tips, and I'm kind of looking forward to that because I kind of like to ask them maybe an uncomfortable question or two. I kind of enjoy doing that. So you guys be ready. Be ready. And then in the afternoon, we will have our breakout sessions, and we're actually going to have the administrator come on and talk for 15 minutes. So it should be an exciting day. And you know what? I think for the day, and with you hear from industry, it's kind of what you make it to. So I'd really like you to engage each other as the day goes on, engage the CMS staff, and I think that's really an important piece of today. Next slide. So a couple tips. The CMS cafeteria, you know, when we do break, it's going to be crowded. I would definitely recommend you eat in the cafeteria. I would not recommend you leave the building and go off-site and try to come back. So we would recommend you eat in the cafeteria. There's different lines down there to move through quicker. You might want to ask somebody who's experienced moving through what's the best way to do it. They have great wraps downstairs if you can get one that's already pre-made. Right outside the cafeteria, and everybody's probably discovered it, there is a coffee bar where you can go order coffee separately so you don't have to go through the cafeteria. But there is coffee inside the cafeteria for those that have been through there before. And the restrooms, we're going to take a little break. Could you go back to the previous slide? Oh, I'm sorry. We are going to take a break after an hour. So the restrooms are right down to the hall to the left. We have a lot of people, so if you need to go, I would recommend you get there quick. It's a small bathroom. Let's move on to the next one. So this afternoon, you know, you can see we have desks out there for industry meetings, some of the program managers in the afternoon, but we also have some rooms set up on the other side of the main area when you walked in where the guards are. And actually, we're going to have a room that's set up just for networking. So if you need a little bit of downtime, you want to meet some other contractors, we recommend you go to C114 or C115. And in C114, in addition to that just being a place to meet, we actually have our National Contract Management Association leadership in the room that day. We're going to have the president, Dave Levitt. Dave, you want to stand up? Don't mind? Okay, he's all the way in the back. We're going to have Mike Blake, the treasurer. Mike, if you could stand up. We're going to have Suzanne Charleston, our vice president, and Dorothy Callahan, the secretary. And Alice Roach helps our events. Thank you, Alice. So they're all going to be in that room, and you should find out about our National Contract Management Association chapter, our leadership at NCMA, and our leadership at CMS and industry have a great working relationship trying to engage industry, and NCMA is a good part of that. We have networking events one month, and the next month we have lunch and learn sessions that actually fill up relatively quickly. So if you want to find out about NCMA, they will be in that room. Next slide. So after the conference, we're going to ask you to fill out a survey, and we do look at the survey results, and we do value your feedback. So if you can go in and please fill out the survey, we would really appreciate it. Don't put any comments in there about me, though. No, just kidding. Okay, let's go. So all presentations from today's conference will be posted on CMS external website, just FYI. So, CMS, we're really working hard to engage industry, and hopefully you'll see that today. We need to engage you because you're our industry partners, and you also need to engage each other. So really what I'd like to do to start, just something a little bit different, I'd like everybody to introduce themselves to two people around you who you don't know. Please do that, and I'm going to take a little break while you do that. Okay, let's get going. Okay, let's get started again, please. Okay, good. Hopefully somebody did enter into a subcontract agreement that quickly. Okay. So, okay, good. Thank you. I appreciate that. I'd like to also do a little show of hands. How many large businesses do we have here today? Raise your hand. Okay, great. Small businesses? Wow. Very good. 8A contractors? Great. Veteran-owned? Good. Women-owned? Very good. And hub zones? Okay. That just gives us an idea of what we have. We appreciate that. Thank you. And CMS has grown really significantly over the past few years and changed. And we really welcome and embrace the change, and you should also. One particular area where we've made great strides, as I've mentioned before, is engage in industry. And we see a lot of positive improvements really around the agency engaging industry. And this Industry Day conference is just one of the many activities OAGM and our CMS program offices are doing to learn about market trends, changes in technology, or unique ways that industry can help us to solve problems or save money on our programs. And your ideas, knowledge, and critical thinking are really vital to support the agency. So today, enjoy the day, ask questions, and get engaged today with others at the conference. And you know what? When we just had that meet and greet, nobody came up to introduce themselves to me, so I'm feeling a little bit slighted here. So please come up and introduce yourselves to me. I'd like to meet you. So our next, I'd like to introduce the OAGM leader and office director, Dan Kane, and he's led us through a lot of these changes. And I just want to give a plug. With his leadership, we have a great office. I think we're a highly functioning office, and we all like coming to work, and we have a great management team. So thank you for your support on that. Come on up, Dan.
Thank you, Brian. his performance appraisal is already over, and it was good. Thank you all for being here today. It's good to see a full auditorium. I think we probably have, with technology, we have people online sort of watching today. So for those of you out there, welcome also. Hopefully it's a good day. We, over the years, have tried to listen to what you all want to have today. So hopefully the day will be have some variety, and next year we'll make it even a little bit better. One of the things that Brian mentioned is this is one way of doing exchanges with industry, and I hear from a lot of you about how you try to kind of get into CMS to try to help us with our issues, whether you have a contract or not. And so hopefully today we'll be able to kind of give you some tips for that. But just so you know, within CMS, it's kind of good timing, the conference here today, and having you all here, because we're doing some things internally to try to educate. I have at the leadership level what they sort of, some leaders are sometimes afraid to meet with industry. They don't always have the time, but we've been giving them tips about what they can and can't do. We recently had a session in this auditorium here with all the CMS managers to let the CMS managers know what they can and can't do when it comes to sort of an industry calling them and asking questions. You're going to see today or yesterday we posted our acquisition forecast. So my staff, and you'll have names from people on my staff and the cores, and so you'll have those people that know you'll be calling, and we'll try to answer your questions to the best that they can. So we do a lot of things that interact with industry. Today, the forecast, of course, you've seen Sources Sought and RFIs, and we have the NCMA, which is a great partner for us because we're able to collaborate with them and kind of train one another on best practices within industry and within the government. So this is just one way of interacting with industry. And like Brian said, I just want to thank you all for sort of helping CMS with our mission and helping us get all of our work done. So who are we? Who is OAGM? Just, I always, when I get in front of a crowd, have to make sure we recognize that we do strive to be a best-in-class organization. We awarded $9 billion almost last year in contracts. We have around 1,200 contracts, around 800 or so contractors with a value of about $35 billion. So there's just some numbers for you to give you the flavor of how much contract work means to CMS and what the value that you all bring to us to kind of help us get our mission done. We do that with around 2,000 acquisition professionals. And those professionals are the 150 or so staff in my office, the 1,000 or so cores, program managers, leadership, different types of people around the agency that really help us get our work done. So we all together have a big job to do. I thought I'd just give you a little flavor of sort of the spending trend here at CMS. You'll see this past year we had a little bit of a dip in our spending as we continued to grow. We just did about $800 million in interagency agreements. By the way, a lot of times they turn into contracts at other agencies. $1.8 billion in our grants. That's primarily went down a little bit, primarily due to some of the stuff on the Affordable Care Act. I think that'll continue to grow, though, also, and then around $6.5 billion in contracting work, which is a little bit of a slide down. Wasn't necessarily because the money wasn't there, it's because CMS kind of made some decisions to push some money into next year. So probably next year's numbers, or this year, will be even a little bit bigger than they've been in the past. So we just keep growing. There's just more and more work, as we all know. We also had a little bit of a dip in small business spending this year. Our goal was around 20%. We hit a little bit over 18% for our small business goal. We continue to surpass in our 8A awards. We did almost around a little over 9% in our 8A awards. Our women-owned businesses, again, the goal is 5%. We were able to surpass that, so thank you, businesses, for there. We still have some work to do in the hub zone, and I think we're actually doing some competitions in that area this year to try to bring them up, and then the small disadvantaged veteran-owned businesses. So there are areas we're trying to focus on and do what we can to kind of help help meet those goals. And I'm happy to see Teresa here today. I'll tell you a little bit about, for you small businesses, some of the tips that she'll have. She'll have some great tips for you. I'm setting you up, Teresa, for a really good talk, by the way. She's a great talker. So I thought it'd be important for me just for a minute. So, by the way, you're going to hear from our administrator, Andy Slavitt, later this morning. He couldn't be here, but I talked him into being on the screen and told him to make sure he wears a nice sweater for you all. So we'll see. You'll be the judge of that. But he's going to have some things to say about kind of where the agency's going. Not necessarily these 8, we call them metrics here at CMS. But I just thought I'd spend a minute just so you know what's going on sort of inside baseball at CMS and what some of the metrics are. I won't go through all of them, but some of the things that we're trying to accomplish to help us accomplish our mission, and these aren't in any particular order. They're just 8 big things to take on. So one is our workforce. That's internal, it really doesn't affect you, but it does in some way because we want to make sure we hire the right workforce that interact with you on a regular basis, and we're actually doing some things to make sure in our program offices we're hiring program managers with the right skills, cores with the right skills. Of course, we make sure we always have contracting officers with the right skill sets to be the best that we can be as we interact with you on a daily basis. We're trying to bring down the backlog of hires. We have a goal there, and we're trying to reduce attrition. Not that it's terrible, but we want people to think throughout the agency that this is a great place to work. And evidence of our most recent human capital survey, I think this is a great place, CMS in general, to work. People really feel connected to the mission. Improving quality of care. Patient safety, we've made a lot of progress in reducing harm to patients within healthcare settings. We continue to do that, is one of the goals. And then to reduce racial and ethical disparities in healthcare to make sure that everyone's getting the right kind of treatment. Decreasing medical cost trends, again, just making sure the cost of healthcare isn't growing at the 8% rate it was for 10 years in the past. It's kind of come down, so CMS is doing what they can in the payment area to reduce that medical cost trend ratio. Delivery system reform, we have some ambitious goals of 30% of all of the fee-for-service payments being made in different various payment models in 2016. And that 50% by 2018 of all the fee-for-service payments are going to be made in various models. So a lot of that's being driven by the Innovation Center, the work that CCSQ is doing internally here, and CM. Of course, we all have to work together to try to make all this happen, and you all working with them, of course, are a big support to that type of thing. Expanding marketplace and Medicaid coverage. We want to ensure there's the target is 10.5 million in the marketplace, consumers that are covered by the federally facilitated marketplace. And then we also have a goal to improve the time it takes for someone to enroll in the marketplace when it comes to coverage. The error rate, we have a goal of reducing. We have lots of different error rates, and some of you are involved in helping us figure out what they are and how to calculate them. To reduce that error rate by 15% for all the various error rates, the A program, B, C, D. Increase program integrity return on investment. So for every dollar we invest, we have a sort of currently a 5-to-1 ratio, and we have a goal over the next 2 years to make that a 10-to-1 ratio. So for those of you that are program integrity contractors, that's a big nut to crack. That's doubling our return. And then also to increase the prevention activities we do in fraud and abuse. And then the last one is reduced Medicare appeals. So that we have a 90% favorable appeals ruling on within the first 2 levels of appeals, and that we decrease the inflow of appeals by 20%. So these are just some of the goals within these 8 administrative priorities that we're trying to achieve. We have others, but I just wanted to give you a flavor today for kind of where we're headed as an agency. Within OAGM, of course, we have a strategic plan. We work with our partners across CMS. We've been doing a lot to help make sure the acquisition community, the 2,000 I talked about earlier, are working together to do what we can in the best kind of way. So one of the things that we'll be doing this coming year is basically what every organization needs, right, is really good communication strategy. We communicate in a lot of ways to you, we communicate internally, we communicate to our managers. So we'll maybe want to hear from you at some point in time about what the best way what are some of the best ways that we can communicate effectively with you. So that's how that may affect you. Another thing that we're working on that will affect you is electronic invoicing. So in the next month or so, you're going to be hearing a little bit about, it's called the IPP platform, Department of Treasury. Our goal is, I think, by next year this time, everything will be electronic. So be on the lookout for probably an email to you saying, hey, here's where we're headed. There will be some training involved, and over the next several months, we'll be sort of modifying contracts and introducing you to how to submit your vouchers all electronically. Ensuring that our CPARS evaluations are complete. I'm proud to say that we're kind of number one within the department, that almost 95% of all of our CPARS evaluations that are required to be completed are completed. A few years ago, the government-wide average was 30 or 40%. Angela's shaking. Yep, Angela's saying yeah. So we've taken a lot of progress there. The goal now is to make sure that those evaluations are the best they can be, and that so that they're helpful to us as we evaluate you for future contracts. We're trying to do a lot of stuff in the training area. So we have our contracting officers, contract specialist training program that's called FACC. We have some goals to make sure that our program managers receive the program management training that's required. So within CMS, there's a goal to almost double the number of program managers that are getting trained. We're well on our way to doing that so that our program managers have the right kind of tools when it comes to managing your program. And then with our cores, they have specialized training too, so we have some goals to make sure we increase the number of level 3, which is the highest level of training that a core can get. And the last thing is our acquisition and grants website. That'll be sort of internally for now, and then in the future there'll be some more of a website, more information that'll be available to you. I know it's hard sometimes to figure out, as like for today we posted our forecast. Sometimes it's hard to get to, but we hope that in the future that'll be a little bit easier to get to. So speaking about our acquisition forecast, it is up, it is available. Here is the link to that. What we've tried to do, there's 200 actions listed in the forecast, and these are all competitive actions. So we give you some basic information, because I know a lot of times that's just what you're trying to get. One is the solicitation going to be released. One is this going to be awarded. What is it? Is it a full and open competition? Is it an 8A? Is it a sole source? Is it a IDIQ? If there's an incumbent contractor, we put the name of the contractor there because we get asked that a lot. And then last but not least, and most important, we have the names of the staff in my office and the program office, so you can call them and you can try to get more information. Again, we're trying to educate them on sort of what they can and what they can't tell you, as opposed to sort of just, no, I can't talk to you right now about that. You know, there is sort of, it does get a little bit gray, but we're encouraging people to communicate as much as they can with you. And then just, we've done this in the past, and we continue to post for you our IDIQ contracts. And here's the link for that. There's quite a number of them, but here's just like in general, the contract, the IDIQs that we have has the list and the names of the contractors, so that if you're interested in subcontracting opportunities, you at least know who they are. So we have the Virtual Data Center, the Quicks, Armada, the PSCs, the ZPICs. We'll eventually one day have the UPICs when they get awarded. So we just try to keep that up to date as much as possible. Of course, Spark will be on there when that gets awarded. Probably, by the way, sometime in the summer is the date for that. I know there's a lot of people anxious to know, and there's a lot of discussion and questions. So I'll just throw that out there that we're still shooting for sometime late July. So just sort of, and Andy Slavitt is going to tell you today what this means, what bring your A game means, and I think maybe some of you have heard that to me, but it's really important for you to know that we are looking for, the best that you have as we evaluate these 200 new procurements that we're going to be doing this year. Even as you're doing work, I always say the only thing you all really have is your reputation. It takes you 30 years to get it and 5 minutes to lose it. And so make sure that you bring your A team, and make sure that you're kind of on top of what it is that we're doing here at CMS, and and that your program managers know what it is that we're doing here at CMS as far as support. And then just last, sort of something to leave you with, and I've said this already, but we're one team. It takes quite a bit to do the work we do here at CMS. There's 80 or 100,000 of you out there. Brian mentioned there's only 6,000 of us, of which 2,000 of them sort of interact with you on a daily basis. But it takes the leadership team at CMS. It takes a leadership team in your organizations. Our contracting officers, contract specialists, cores, program managers, pricing, auditors, attorneys. It takes a lot to make sure our contract work is moving forward effectively, and you are a very big part of that. And I thank you for all your work. So with that, I just thank you, and Brian will introduce our next speaker. Thank you.
Yeah. Before I do introduce the next speaker, I'm going to acknowledge some of the people that put the Industry Day on today, because I don't think we'll have an opportunity to do it later. So I want them to stand up, and I might be missing some people from the team, but it started here. Linda Hook, Group Director. Deborah Stidham. Chip Farmer. And I'm not sure where Jaime is, but, oh, Jaime, okay. Yeah, right in the front row, I should have known. Okay, good, thank you. So our office has a great working relationship with our next guest. She is actually the Senior Procurement Executive for all of HHS. She is the Associate Deputy Assistant Secretary of the Office of the Assistant Secretary for Financial Resources for HHS, and it's Dr. Angela Billups. Thank you.
Good morning, everyone. Well, I'm glad to be here this morning. Dan just said that, we scared him, Teresa and I, because he expected us to be here at 9 o'clock, and I expected to be here at 9 o'clock too. But I was just telling him, I said, you know what, on Friday mornings when I go to work in DC, the traffic is not that heavy. And so I can get from my house, I can literally get here in about 15 minutes, and this minute it took me about 25. When Derek called me, it was like 9:02. I said, Derek, I'm outside the gate, I'll be there, okay? But I'd just like to reiterate some of the things that Dan has already said. There is a lot of good work that's going on here at CMS to move forward the overall HHS mission of providing health-related services as well as support for the American public. And that's basically what we do on a day-to-day basis. We keep the American public in mind. And with that, we see our jobs as acquisition professionals to help kind of bring this acquisition community together so that we're all growing, but we're all also keeping in mind at the end of the day, we are supporting a child that needs something as it relates to their health. An older person, your mother, your grandfather, your children that may be middle-aged, but yet they have some health problems. That's the reason why we're here, and we keep that at the forefront of our minds. And in addition to try to keep that at the forefront of our minds, of course, we have these things called regulations that we have to follow, and then we have other things called statutes and executive orders and things like that that we have to follow. But what we have to do is just understand how all of that impacts where you sit. Because for most of us, we understand why we do this, we understand what we're doing it for, but we also ask the selfish question of what's in it for me. And we get that. We absolutely get that. And so with that in mind, I really, Derek had called me earlier. I went on vacation last week and I told everybody, I said, I'm going dark for a week. I'm going to be like a CIA agent. You are not going to hear from me. And I cheated a little bit. I sent 3 emails. But I did. I just said, you know what, I have to have some downtime, and I'm just not going to do anything as related to work. But like I said, there were 3 things that I saw. I said, maybe I need to respond to those 3. But Derek called me earlier this week to ask me, well, I wasn't sure if you had any slides. I said, well, if I don't have any by now, I guess I won't. So I don't have any slides. And so with that in mind, I just wanted to talk to you about a couple of things that's going on from the federal perspective as it relates to the department as a whole, and how you fit into that and how CMS fits into that. There are several things that's going on, and I know that, well, I hope that most of you have kind of been looking at different areas where you can look to see that there are a lot of information and a lot of talk in the media and different places about reforming the federal acquisition landscape. And of course, if you've been around this business for a while, and I have been around this business for over 30 years now, and we go through acquisition reform probably every 10 years. And every time that we've gone through the acquisition reform, I think, that we have made some improvements. And then there have been, because I have the ability to look back over 30 years, we have kind of gone in circles. We said that wasn't good about 10 years ago, and then swing forward 10 years later, and we said, well, that is good, so we need to go back and do that again. And I don't think that that's basically kind of what's happening this time. I think what we're trying to do this time, from my perspective, and from my perspective as a senior procurement executive for HHS, having some influence over what acquisition reform looks like this time around, I think we're really trying to look across and to say, there were some good things that we've done over the years, and there are some good things that we can keep on the table, but there are some things that we need to do to change. So some of the things that we're doing at the federal level that is impacting all of the federal acquisition landscape is looking into how the government can be one buyer. The federal government is the largest buyer in the entire world. There is no buyer larger than the federal government in the entire world. So with that in mind, there are some opportunities for some things that we buy that we just have not been buying smart. And so with that in mind, some of the things that we've been looking at over, started probably in the 2008, 2009 timeframe, we started talking about something called strategic sourcing. And we have evolved strategic sourcing as this one single buyer to something now called category management. And what we're doing is we're looking at several categories of spend, and CMS is doing some of that with their IT buys and other buys, looking at various categories of spend to see how we can pull all of those things together and pull the dollars that we're spending as well as how we're buying them, because to write 10 contracts takes 10 different contract specialists, 10 different contracting officers, and all of the support groups that go along with that. But if we're all buying the same thing, where we can put a list of the specifications or the specs that we need for that laptop or that desktop and do one contract and everybody buy off of that contract, it's just a smarter way to do that buy. So what we're focusing on at the federal level now is looking at those areas where we, as the government, can buy as one in something that we're called category management. So I don't want to talk about that very long. What I wanted to do was just to let you know that when you hear the term strategic sourcing, it may mean something to you, but we have evolved from strategic sourcing. Strategic sourcing is still there, but what we're evolving to is category management and trying to look across the federal government to see where we can buy as one and leverage the dollars, as well as make a smarter buy so that we can take these resources that we have and use them better, because we're not getting in more resources to do the different things that we have to do. And we cannot contract out everything that we do in the government. I need a job. And I'm sure all the federal employees here would say they need their job. But what's good about us that work at HHS, like Dan said earlier, we love our jobs. So we want to continue to do those things that we're doing. Derek, let me know when I have 5 minutes, okay? The other thing that I wanted to talk about, if you are in the IT business and you have not taken the time to look at the Federal Information Technology Acquisition Reform Act, I would ask you to look at that. That is a shift in the way the government has been doing business as it relates to buying IT. And it is trying to put some structure around how we acquire IT in the government. And it is forcing that look across department-wide to see how HHS is acquiring IT, and HHS does acquire quite a bit of IT, as in most federal agencies, because when you really think about it, there is not a thing that you can do on your job today that you don't turn on a computer or a smartphone or something to do whatever it is that you do. But what we're trying to do now is trying to take the focus off of the system and the technology and put it on the business processes, the business practices, and the business procedures, because that's really what it's about. If you don't get your business process right, you don't get your business practice right, and you don't re-engineer those things, what you do is take something that you was doing on a manual process, put it to the speed of electrons, and you still have a failed system, and we don't want that. I have 5 minutes? Okay, that's good. Uh, and so let me just go really fast through some of the other things that I wanted to talk about, and some of the other things that I wanted to talk about. And what I wanted to do today is to give you some information, some things for you to think about and walk away and be interested enough to go to a website or something and try to look some of these things up. One of the things that I've done recently is updated the HHS acquisition regulation. The reason why I updated that regulation, because as it exists today, it has guidance, instructions, and procedures included with the policies and procedures that only impacts industry. And I wanted to separate out the parts that impacts industry so you would have a place to go to look at the federal acquisition regulation, then the HHS acquisition regulation, so that you will see how that impacts you as a contractor with HHS. So I am proud to announce the HHS acquisition regulation will be published in the final version of it will be published in the Federal Register within the next 2 weeks, and within 30 days after it's published, it will be implemented within 30 days after it's published. The other thing that we're doing that I want to talk to you about is the government is doing a really big push on environmental conscious organizations under sustainability and green procurement. There's going to be a push to ask the vendors that do business with the government to tell us how you're participating in that. We have not fully rolled that out yet, but it is something that you will see. You will see some of you will see the first iteration of that in the mid-2016 timeframe. It has to be implemented across the federal government in 2017. So if you are doing things that are environmentally conscious, and there are places that you're reporting that information, we have gone to industry to find out what is that centralized portal, but you will be seeing more about how we are only going to be doing business with vendors that are environmentally conscious. And the last thing that I wanted to talk to you about, because I want to give you a few minutes if you want to ask me a couple of questions, is the places that you can go to see kind of what HHS is doing as a whole and not just CMS. Most of you should be familiar with USA Spending. It is a place that you can go and you can look and see history of some of the things that we have awarded contracts to vendors. You can also go to the Federal Procurement Data System. Next Generation, both of those are public-facing systems where you can get information that can help you to see where we've been as far as contracts that we've awarded at HHS. And in the future, you will also see update to USA Spending, because what they're doing with USA Spending now is they have gotten a lot of information from you, and what we're trying to do is to make it more friendly towards those people that we want to use that system, because USA Spending is not about the government, it is about those various vendors and contractors and people who want to find out what we're doing with our tax dollars. It's really about transparency. And since Derek told me I only have 5 minutes, I think I used up 3 of those 5 minutes. I have about 2 minutes or 1 minute. 1 minute. So if anybody want to just ask a general question, don't ask me anything about CMS specific. That's why Dan is here. But if you want to ask me an overall question about HHS and some things that we're doing, I will give you that 1 minute back. Anything?
How is HHS Department CIO's office interfacing with CMS in light of FATAR?
You mean the department CIO? Okay, basically each one of our...
Could you repeat the question?
Oh, okay, he asked me to repeat the question, and you tell me if I got your question right. The question is, how is the department CIO interacting with CMS? Is that your question? On FATAR. Okay. Basically, the way that is happening, the department CIO in FATAR, if you would read the act itself, it says there are specific things that the CIO at the department level has the authority to do, to approve, or to implement. So what's happening at the department level, we, HHS, had to send a plan to OMB to say how we're going to implement the tenets of FATAR. We have done that. And those plans will be published once they are approved by OMB, so you can look and see what the HHS plan is. And I don't know when OMB plans on publishing those plans, but they will be published. You can see them. So the interaction between the department CIO and CMS has a CIO. And so what's happening is we have a working group at the department level that consists of the department CIO, the CIOs in various operating divisions, CMS, CDC, NIH, and we all sit around a table and we kind of decide what that means for HHS as it relates to reforming IT and the way that we buy IT. That's how that works. Okay? Anything else? Thank you.
Great, thank you. Our office works hard to locate and award contracts to small businesses. We couldn't do it without the support of the HHS Small Business Office, our next guest, and a member of her staff, Anita Allen. I'd like to welcome Teresa Lewis, the Senior Executive for a Small Business Program at the Department, and she is the Director of the Office of Small and Disadvantaged Business Utilization for HHS. Thank you.
All right, I, unlike everybody else, has a presentation. So while Brian is educating me on how to move forward, because all I really can do is turn on the computer.
You can
Oh,
tell
you got
her.
me?
She'll get-
Okay,
she's got-
perfect. Okay, so first of all, let me just say congratulations to all of you. You've got the hottest ticket in town. So congratulations to you on that. And I just want to thank Dan and Derek always for the invitation. Brian, thank you. And Derek, I need to thank your staff because I too, like Angela, was stuck not just one beltway, but two beltways. So I'm just glad I didn't see the cops. So you can slide through the next one. All right, so I understand the veterans have already stood. So to you, though, I will just say thank you. You know how I feel about you. It's extremely important because what I'm clear on is we wouldn't be able to sit here in peace were it not for your service. So I thank you all for that. And for those veteran and service-disabled veterans on Monday, we are hosting a vendor outreach session that is specifically for you. So if you are a veteran-owned company and you're interested in coming, there's information on our website, or contact barbara.bigelow, B-I-G-E-L-O-W, @hhs.gov, and we will get you in. Okay, next slide, please. All right, so Angela already discussed the mission. I won't belabor it. That'll save me 30 seconds. Thank you, Angela. So these are the top 10 organizations or buying activities within HHS, CMS being one of our top 4. And we thank them for that. HHS is responsible statutorily for implementing over 300 programs, some that you may not be familiar, like food and safety inspection, some that I'm sure you are, like Medicare and Medicaid services. Next page. We hire over 85,000 employees. We award over $400 billion in grants annually. So needless to say, and I think Angela mentioned it, we're the largest grant-making organization in the federal government. For contracts, we award over $21 billion, that's a B, annually, and we award over $4 billion to small businesses. So the SBA tracks the stats of 4, what they call CFO, that 24 organizations that have chief financial officers. Of those 24, what we award to small businesses is greater than their annual spend, greater than 18 of those agencies' total annual spend. So I say that to say we award a lot of money to small businesses, so we put our money where our mouth is. Just a highlight of what we buy. Of course, this is not everything. As I tell everyone, we buy everything except that which supports the warfighter. We don't buy tanks, planes, and ships. Thank you. So this is my favorite eye test for you. Just a few best practices. I think you guys are going to get this presentation. Some of you have already seen it already. But just a few things that I just want to share with you. I love what Dan said. He called it the A game. I like that. You know, they're looking for the best. And that's government-wide. Times have changed, as many of you know, where it's not that they're just looking for any old small business. They're looking for quality small businesses as well. So, examples. Responding to, or how you can become a gamer. Responding to RFIs. Responding to solicitations so we know you're out there. Can you go to the next slide? making sure your SAM profile is complete, making sure that your industry codes in SAM are related. If you have, and I know that there are some consultants that'll tell you, put all of these NAICS codes in. Don't do that, because we will have no idea on what you buy. Next slide, please. The budget in brief. If you're not already familiar with it, you need to get familiar. It's available on hhs.gov. It is the one document that I say to businesses, especially small businesses, if you're looking for a place to start in determining who do I market myself to, Budget in Brief is going to tell you, because it's going to give you an idea of the justifications of what each and every agency has said to Congress. This is how I intend to spend my money. That's a great place to start, because if a program is going to be defunded, it's going to be in that Budget in Brief. If they're going to put money towards a particular effort, initiative, it's going to be in that Budget in Brief. Next slide. Easy search. How many of you are not familiar with the Federal Procurement Data System? All of you are. How many of you actually use it to conduct market research? Okay, so everyone is aware of it, but everyone is not using it. Can you go to the next? If you just in that market research, okay, I got to work on my slide, that if you just put in your NAICS code, it's going to tell you every federal agency that's buying what you're selling. Because you can't sell to everybody. I know you would love to, but you can't. So you really got to hone in. This tool is going to help you do that. Next slide, please. From there, the particular contracting office is going to be listed. Who's the incumbent? Who's your competition? Wouldn't you like to be Taconic Farms? They have a BPA with no expiration date. Fantastic. Okay, next slide, please. The HHS forecast, it's available at http://procurement forecast, all one word, .hhs.gov. And the agencies, the program offices are populating it more and more each day. So definitely, just in looking for places to start, this is one of those tools. Next slide, please. FedBizOpps. Contrary to what you may or may not have heard, HHS uses FedBizOpps. I know some of you have heard, well, once it gets there, it's too late. It's not too late. If you don't respond via FedBizOpps, we're not going to know that you're out there, and I can't fight with Dan and his team. So you've got to respond. Thank you. Ebola support, you may not still be hearing a lot about it in the news, but HHS is still doing the work. These are some of the agencies within the department that are still doing Ebola work. We're looking for support. Capability statements, your capability statements need to be alive. So what does that mean, Teresa? That means that what CMS buys is not what the CDC buys. It's a different mission. It's what HHS buys is not what the Department of Justice buys. It's not what the Department of Interior buys. So if you've been selling, for example, to DOD, and now you're coming to a civilian agency and you want to provide support, don't give me a capability statement that tells me how you wrote code for, the battleship out in Norfolk. I can't do a thing with that. So it needs to be in a way that it relates to my mission, to the mission of HHS, or whatever organization that you're targeting. Next slide. Okay, so I won't spend time on that. You guys know a business card, it should be like a mini CAPE statement. Get as much on it as you can. All of that frilly stuff that you may have on that, next slide, we can't do a thing with that. When I get back to the office, the fact that you have your motto or we are a green company, I can't do a thing with that. And while I love you all, I just never remember your names when I get back. But if I have your business card and it tells me, these are your NAICS code, these are your certifications, then I know who to direct or refer your company to. Next slide, please. All right, networking, just how important that is. I congratulated you for being here. We host monthly vendor outreach sessions. Anita, whom I'll introduce shortly, actually hosts access forums. We also have vendor outreach sessions, and I'm sorry, I mentioned that, but we're having what we call back to business events this year. We're going to Albuquerque, Nashville, Boston, and George Mason. How many of you were at our event at Catholic University last spring? Some of you were. Was it a good event? Yeah, so we're trying to make it better each year. We have contracting officers, senior procurement officials, heads of contracting. We have lots of prime. We invite our top 25 prime contractors out. So we try to make it a valuable event. You've got to come so we know that you're there. Next slide, please. This is my favorite slide always. And I use this to say contracts are getting larger and larger. The acquisition workforce is getting smaller and smaller. Angela talked to you about category management. You're seeing more of that. So we're looking for you to team. If you can't provide the holistic approach to a procurement opportunity, we're looking for you to team. Just be careful. That's why I put this here. Like a marriage, easy to get in, right? Hard as hell to get out. Be careful who you team with. Next slide. All right. Existing contracts, just some that are listed. Dan and his team are working on, some other contracts that we'll be able to use throughout HHS. But HHS has awarded the largest GWAC for small business primes, $20 billion at NITAC. If you're not already one of these contract holders, you need to be, because the contracting officers are going to these tools. All right, next slide, please. Know the rules that govern the program that you're in. Whether you're a hub zone, whether you're a small business, whether you are a woman-owned small business, service-disabled veteran, become familiar with Title 13 of the Code of Federal Regulations. Sections 121, 124, 125, 133. Those are the areas, those are the sections of the regulations that SBA promulgates, the Small Business Act. Know what you can and cannot do. Know how you can enter into a joint venture. Just to keep you out of jail. I don't like to hear when small businesses go to jail. So know the rules that govern what you do. Next slide, please. Do your homework. I just can't tell you how important it is. The tools that I've shared with you already, know that so when you sit down, don't start a conversation. I noticed coming in that there's going to be some conversations with Anita and some of Dan's staff. Don't start the conversation with, hi, I'm a small business, or hi, I'm a service-disabled veteran, or hi, I'm a woman-owned small business. The truth is, we care about that last. We care more about how can you assist me with my mission. So when you sit down with us, you need to start that conversation with, hey, Dan, I know that Dan and his team are looking for IT contractors to do X, Y, and Z. I have a better mousetrap, and let me tell you about it. Oh, and by the way, here's an easy way for you to get to me. Then you can talk about your certifications. You got to change your paradigm. Don't ask them, what do you need? You got to do your homework before you come, okay? Talk about the mission. That's what we really want to hear. Next slide, please. Meeting your customer needs, whether you're large or small, that's what we're looking for. Dan called it your A game. We're looking for better, smarter, faster, cheaper, more efficient, innovative. Next slide, please. Just some best practices in a summary of what works. Next slide. All right. Knowing your point of contact. Anita, can you stand, please? Anita Allen, if you don't know her already, you need to know her. Anita Allen is on my team. She's a small business specialist that represents CMS. All right? And just be prepared when opportunity knocks. It takes 18 to 24 months to build a relationship. A lot of times, unless you're lucky, it takes that long to get a contract, in all honesty. All right, know who you need to talk to, but when they knock on your door, be ready. If we call you for an oral presentation, be ready. I have had small businesses to come. We invite them in with an intimate audience of decision makers, and they came in, and you know what they wanted to talk about? The awards that they have received. Do you think that program manager cares? No. They want to talk about solutions. What have you done at Army? What have you done at, Interior, one of these other agencies that help them solve a problem? That's really what they want to know. Don't waste that opportunity, guys. All right, next slide. I'm getting the hook. This is my motto. This is what we truly believe. Next slide. Social media. I have young people that work for me. They're telling me I'm also going to get to Periscope. I don't even know what that is, but I'm going there. So we do have videos on YouTube. If you haven't done so already, guys, please go there. Take a look at them. We have individuals like Dan who have actually recorded videos on how to do business with their specific agency under HHS. Okay? Anita's point of contact. If you don't have it already, here it is. All right. So I have 1 minute for questions, I think. Nope. They say no.
I just want to tell you one thing.
Oh, what?
We ask veteran-owned businesses to stand up, but not veterans, just FYI.
Oh, okay. All right. So Brian just told me that they asked services say, well, veterans to stand, but not all veterans. So before I go, before there are any questions, can you, if they're all veterans, please just stand for a minute. Okay. So. And I just want you to know the first ones to stand were in the Air Force. I don't know about those other ones, but I'm just saying. Aim high, I'm just saying. All right, so are there any questions? Nope. All right, fantastic. Well, thank you and good luck.
Okay, I have that it's right now, it's 10:06. So we're going to get started in about, we'll call it just about 10:20. I'd like to say 10 minutes, but I'm not sure that 9 minutes is enough time. So, but I do have one request, just something a little bit different today. When you get up and you go stretch and leave, when you come back, don't sit in the same seat and introduce yourself to two other people. Thank you. We'll see you at 20 after 10.
We're gonna flank you.
Yeah, I need my cost person here with me.
Hey,
How are you?
good.
Good.
You got all that.
Yeah,
I think so. Yeah, it is. For Carolyn?
Why don't you and I just share, and then we can let Carolyn sit here.
Okay.
You and I can share, because we're answering a lot of the same stuff. So put Carolyn here, Deb. There you go. You need this over
No,
here?
no.
You know where it is?
Yeah, it can stay there.
Okay.
Is everybody?
Anywhere. I think here. Hi, Carolyn. I'm Chip Farmer.
Carolyn Robinson, nice to meet you.
Yeah, nice to meet you.
And the microphones, do you want? We could put them on the floor. It's not gonna cost. How are you? It's not gonna cost. Robinson. I remember. Brian, just do this. Yeah. So we don't know. What's he telling us?
Well, they should turn him off right away when he's cued to come on. You would hope.
Over there? When do we put our, even which way you wanna go?
Okay, we're going to get started in 4 minutes. 4 minutes.
Get stumped.
How we doing?
Start reading from the sports section.
Yeah, we're going to get started in 2 minutes. Whatever you want to do. No, I'd just say title. Okay.
Where'd you test it?
Okay, we're getting started in 1 minute. We're getting started in 1 minute. Oh, we've got a big panel. Are we ready? Okay.
sir.
Thank you.
Okay, let's go. Everybody sit down, please. We're going to get started. Okay, I did fail to introduce one person, and I'd like to introduce him. He is our small business representative with the Small Business Administration, and actually all of our procurement packages and CMS actually passed by him for signature. So Claude Cable, you want to give a stand up and thank you for coming today. I think you work out of Aberdeen, don't you? You didn't see a tether coming by yesterday, did you? Came by. It did come by your house, did it? Oh, okay. Okay, good. Okay, so we're going to get started here, and you know, this is my favorite part of the day, is to kind of ask these guys some, I don't know, you might call them softball or hard questions at the end of the day, but I did have one person here on the panel, and they came up to me yesterday, and they said, they actually said that they were going to provide you guys a tip that's going to win you a contract every time, is what they told me. So they told me to ask them the question. So Deborah Stidham, what's the winning tip? What's the winning tip?
We can't guarantee you'll win a contract, but we'll give you every opportunity to do so.
Okay.
You do your part, we'll do ours.
That sounds like the tip I give everybody about who's going to win the Super Bowl, right? Anybody know who's going to win the Super Bowl? Nobody knows. I'm the only one that knows. The team with the most points, right? The team with the most. Oh, okay.
Someone
Okay.
thought it was funny.
Well, let's go. Don't put that in the survey. Okay, you didn't like my joke. Okay. So, with that said, we're going to go through and do introductions first. And Don, you want to start down on your end?
Good morning. I'm Don Canode. I'm the IT Contracts Group Director in the Office of Acquisition and Grants Management.
Good morning. My name is Bridget Reinecker, and I'm a technical advisor and a contracting officer within the Medicare Administrative Contracts Group within OAGM.
Good morning. My name is Chip Farmer. I am the Division Director for the Eastern Medicare Administrative Contracts.
Hi, my name is Carolyn Robinson. I'm a Group Director in the Office of Technology Solutions, Governance Resource and Management Group.
I'm Anita Allen. I'm the Small Business Specialist from the Ostabu office, currently supporting CMS, and I've been here for 3 years now.
Hi, I'm Deborah Stidham. I'm a Division Director and a Contracting Officer in the Medicare Administrative Contracts Group in the Office of Acquisition and Grants Management.
Good morning. I'm Nathaniel Dean. I'm an Acquisition Policy Team Lead and a Contracting Officer with OAGM.
Okay, so we have a lot of years' experience here. I can't add it all up to say who has the most, but looks like about 150 years' experience as we're sitting here. So, so the agenda, we're going to go through 3 topic areas, and at the end of each topic area, we're going to actually open it up to questions. So we have 4 people standing around, and you know, we'll just kind of do random for people to answer the question. But before we do get started, I'd really like you guys to kind of give us what you think your big tip is from the inside before we hit some target areas. So we can start. Don, you want to start on your end?
So there's been a lot of talk this morning about interest in getting innovative solutions and cost reductions when you propose to the government, and that's all very true. But my tip is around the importance of demonstrating within your proposal how that innovative solution has been successfully implemented somewhere else, or how that particular solution will work within the CMS environment. I think it's really important to recognize that as we're evaluating proposals, that we're also trying to assess the level of risk related to those. So if it's an innovative solution and we're not completely sure that it's been implemented before, obviously there might be some concerns about risk, and that may impact how we view your solution.
Okay, Bridget?
Good morning. My tip is more so related to knowing your solicitation and knowing your contract once you get it. And there's been a lot of talk about bringing your A game, and how I would recommend that you approach any kind of conversations or your solicitation with the government is to view it as a job interview. For example, if I were on an interview and I just stated my experience and talked about all the agencies that I've been with and the different divisions and the titles I've had, that doesn't really mean much to the government. But what will land me a job is if I say how my experience will benefit you and how my experience will give you success as a company, and that's what the government is looking for. what can you do for the government, and that's how you can land a contract, that's how you land a job.
Chip?
My tip is I suggest that contractors provide thorough and well-developed business proposals that would mitigate the need for questions from the evaluation team. Oftentimes, when we get into discussions, there's a lot of back and forth because there are some misunderstandings as to how costs are proposed, and if we could mitigate that process, we could award contracts more efficiently.
Okay, before we go, Ken in the back row, if you can't hear anybody, you need to let me know, okay? Thank you. Okay, Carolyn?
All right, so I think, one of the folks on the panel from the program side, and I say this in most forums, and some folks listen and some folks don't. The ones who listen, I think, are more successful. A lot of offerors, contractors assume the government's going to go through many, many rounds of proposals, best of finals, well, they'll get one more chance. To the extent possible, the program offices, and we certainly do this, are awarding on initials. So when you come in with your proposal, don't assume, well, my cost will come down later, I'll change something later. Your first proposal needs to be your best proposal, because more and more we are awarding on initials. We have a lot of procurements, and that's something we're really looking for, so that's my tip.
Great.
Hi, I'm Anita Allen, Small Business Specialist. My tip is probably repeating some of what the panel said and the director, Teresa Lewis, of the OSTBU office. Be prepared. Know what the government needs and when it is needed. With that means do your homework. Know the target agency. Look at the CMS budget and brief. Know what CMS buys. Search the Federal Procurement Data System. What can you do for CMS? Not what we can do for you. Don't meet with me and say, what do you need? I sell this. Can I get a contract? I'm a hub zone. I'm a service disabled. I got a call a few weeks ago. We sell temporary housing. If that company had done their homework, I wouldn't have gotten that call. CMS doesn't buy temporary housing. Do your homework.
Deb?
My tip is bridge the gap between your proven capabilities and the government's requirement, whether you're responding to a sources sought notice or a solicitation. If your proven history is to process 100 claims an hour and we need you to process 200, make it clear to us how you're going to get there, since your historical data says you haven't gotten there.
So my tip is specifically for sources sought. How many small businesses do we have in the room? Show of hands. Fantastic. I'm speaking to a lot of people. The sources sought notice is your opportunity to go off of Bridget's as an interview, to really explain to the government your capabilities. And my tip is to read those carefully, read the questions carefully, make sure your responses address those questions. I've seen sources sought notice responses, everything from a 2-minute video, when we requested a 20-page document responding to several questions, to a 300-page treatise on everything this company has ever done. And that's not beneficial for us. Please really, really read those, respond to them, because oftentimes we're not aware of what you're capable of, and if we get bad responses, we make the decision then this isn't appropriate for small business. So this is your opportunity really to shine, and so my tip is to focus on sources sought notices.
Okay. So we're going to start our first topic, and the first topic is information gathering and planning. And anybody feel free to speak out, or I'm going to call on you. So let's just go. What steps can industry take to stay informed of upcoming CMS opportunities? Nate, you want to start on that one?
So I think is to kind of get a sense of our year. So every February, we release a justification to the Appropriations Committee explaining a lot of the programs that we have here and a lot of justification for what we need budget for. That's the first step. Everyone should download that. You can Google it in February. You get a sense of where CMS is going, the programs that we have, and you can get a sense of what you offer and which departments and groups you need to speak to. In October, we release a forecast on cms.gov for contract award opportunities. So in February, if you got a sense of, all right, this is the programs, this is the direction, this is where we fit, you can then look at the forecast and say, all right, these are the programs, this is what they're intending to buy and there's contact information there. And so that's where I'd look for opportunities.
Okay, how about Anita? That should be a...
I have, look on eBuy for sources sought notices, look in FedBizOps, look in the Federal Procurement Data System, know what procurements at CMS are ending. Not always just the new procurements, but these follow-on contracts. I've had a company come into me, and he actually went into federal, he knew how to market himself. He went into the Federal Procurement Data System, then he went in to do an SBS, the Dynamic Small Business Search, to look who was getting these contracts. He was a HubZone company. So he said, okay, this agency is buying this, and they've awarded to large businesses. My company can do this. I'm a HubZone. I need to target this particular agency. So don't always look just for the new procurements. Also look for the procurements that will have follow-ons. And also look for subcontracting. CMS, if you want to get into CMS and you're a small business, your best opportunity is to look for subcontracting opportunities. Become a member of the NCMA. The Woodlawn chapter, they do a lot of networking. Tonight there's going to be an event. Meet large and smalls that are trying to get in CMS or that want to get in, that are already in CMS. Also, the last thing is there's a lot of larges that are here today that have reached out to me, and a lot of that are working with me, and a lot of large businesses here that I hope reach out to me today that want to work with me, that are looking to give you opportunities. But again, you need to be prepared.
Can I add two things to that? With FBO, interested vendors list. If you're interested, please select your interested vendor list. I've received calls from large businesses doing big procurement saying, we'd like to know what small businesses are out there, and I've received calls from small businesses that didn't say they were an interested vendor, so the large business wasn't able to find them. Being very adept at using FBO is very, very important for finding opportunities.
I just have a curiosity question for the audience. How many people in the audience use GovWin? Okay, how many use Bloomberg Gov? Okay, how many use something else? Okay, how many don't use anything? Okay, well, that's good. Lou in the back, a CMS employee, he doesn't use it either. All right, that's good. Thanks, Lou. Okay, so next question. What is a sources sought notice, and how does the acquisition team use the information in decision making? And who wants to take a crack at that? Nate?
So the sources sought notice is a market research tool that we use to determine whether or not small businesses are capable. And, this is really to my hint or, thing that you should take away from this. And so we use that to judge, all right, out there in the world, is there a small business that is capable of providing a proposal that could potentially do this work? And so it's so important that you read those and respond to them fully and briefly so that we have an understanding of your capabilities.
And I'd just like to add to that, kind of piggybacking on some of the messaging from Teresa's presentation, I've also heard from industry that they believe when we put the sources sought notice out that it's just something we're going through the motions and they don't respond. And I would encourage you, not only that you respond, but if you're a small business, if you're an 8A or a service-disabled veteran-owned or HubZone, encourage your fellow small businesses, HubZones, service-disabled veteran-owned to respond, because the rule of two or more will apply when we're making the decision about whether or not to set it aside.
Okay, let's flip it.
Can I add something?
Go ahead.
Please. A perfect example to what Deb said is the Spark requirement. If it had not been for industry using their bullhorn, is what I say, we would not have been able to do what we did with that procurement. So think about if you did that with every procurement here at CMS. I tell small businesses all the time, you need to help me help you. So pull out the bullhorn. And also when you're responding to sources sought notices, if you have teaming partners, one of the questions, and you say, well, I will sub with someone, that just threw that capability statement out. So don't waste your time, don't waste our time responding if you're not going to respond completely. And make sure you have your teaming partners' capabilities in your response.
Okay, let's flip it around and talk about RFIs. Anybody want to talk about RFIs and how we use them?
Go ahead.
RFIs are, so the government, when we send a request for information, we're really saying, hey, we have something typically new or we're trying to go in a new direction, so we're looking for input from industry. We're looking for your expertise. We're looking for your ideas and how we can potentially incorporate them into the direction that we're going. That is a great time to get on the ground floor because you'll be able to participate in the process from its infancy, potentially all the way up into a contract and development of a requirement. And so I would encourage everybody, if you see an RFI that's in an area that you potentially could provide expertise, even if you're only talking about a small section of it, provide the information to us. You know, we're really at that point in an information gathering stage because we want to learn as much as possible from you.
Okay, Deb, anybody else?
You know, I'm going back to Don Canode's tip, and I see that correlation between an RFI and the tip that Don provided, as well as what Nate said. It's really an opportunity for you to help us, for you to share your expertise, and we take that. We take it into very serious consideration and appreciate it.
Okay, anybody else want to add anything? Bridget?
I can add to that. Also in RFIs, a lot of times you will see draft solicitations and draft RFPs. Take that opportunity to speak to the government because that's the opportunity you have to talk freely with us and to ask questions and to find out more information because sometimes our solicitations aren't entirely correct at times or aren't thorough, and that's why we take the opportunity to put out those draft solicitations. So take that opportunity and let us know.
Anybody else?
Let me add one thing to that comment. We in our office do RFIs occasionally, not a lot, but occasionally, and when we do, we are interested, as you said, in what industry thinks. We do it a lot of times to get the technical thoughts, aspects. We have, software doing certain things. We have contractors doing things a certain way, and we just have an RFI out now on the EIDM, which is very integral to marketplace, because we want to look to see if there's a different way to do that, and there are other technical solutions to that. So do take RFIs seriously. RFIs usually result in RFPs. RFIs are either when we have questions or when we have a little bit more time to gather information. So do take that seriously.
Okay. You know what, just for time reasons, I'm just going to open it up on the floor, and if anybody has any questions, we have lots of people around with microphones. Just give us your name and ask the question.
Hi, my name is
Yep.
Mary Byer with Maxon Consulting. The panel and everybody spoke about quality and proving out you've done it and what can you do for CMS. And one of the first solicitations I saw from CMS that really made you prove that and evaluation criteria against that was Spark. Are we going to start to see more acquisitions and RFPs that ask the vendor to prove out that solution and validate that they've done it?
You know what, Don, you want to answer that one?
Well, hopefully so. That's, I think, a trend where we're heading towards. I would say on top of that, I know like when I interact with a lot of program offices, there's a much greater interest in seeing something, so not necessarily just seeing it written in a proposal. So there's a lot of discussion internally about how do we identify and select the best contractor, and we're looking at different ways to do that, some of which may be to have someone come in and provide a demonstration or to provide a prototype. So we're looking at different ways to do that, but I think the core of what we're trying to get to in our solicitations is to understand what the solution is and that the solution is achievable, quite frankly. Yep.
Okay.
Hi, I'm Denise.
Well, just anybody else want to add to that? Or I will, because I have something to say. And I would say the one thing that you can do is, I mean, if you see other agencies using some of those prototypes, I mean, we'd like to see them. So I would recommend you, try to get a schedule meeting with some of the contracting people, even the program people, not run the requirements out on the street, but, we'd like to see some good samples of other agencies' scopes of work, deliverable schedules, evaluation criteria. That's how I think industry can provide some value added to help us with our acquisition strategies. Even if it's an RFI, that's the formal way, but if you've seen some things, schedule a meeting, Mary, with Don, and talk about it. Anybody else want to add to that? No, I'm sorry.
Hi, I'm Denise Demers. I'm a small business, but I represent Long-Term Care Partners, owned by John Hancock. And one of my questions, they're a very niche player, and I think Nathaniel answered this in part on RFI. So if there's a piece that one can respond to, you all will look at that even if they can't respond to everything in whole or choose not to because of the area that they're working in. And this would also apply to other companies that I've represented in the past. I heard you say yes to that. Did I hear that correctly?
Yes.
And is that true across the board?
It's one of those things, it's absolutely situational. Things that we receive, we will review, but, if we're having an RFI and potentially, let's say we get 300 responses, we might go towards a response that's addressing more of a requirement. I would also say really read the requirement. If it's an IDIQ, for example, and it looks like, might be grouped as a specific task order, that would be a great question that you can follow up with the CEO or the program manager to get an idea of, okay, this is our niche. How do we potentially fit in here because we think we can provide something, really worthwhile. And then it goes back to what some of the other panel members said about subbing opportunities,
right.
And then following it.
Right.
And so that would be my recommendation.
Okay, and would the same apply to sources sought notices as well?
That was the point I was going to make to your question, that responding to a sources sought notice, like Anita said, would be very different. Here, in that situation, we've defined our requirement. We're primarily using that as a basis for market research to see if there's capabilities in the small business market. An RFI is different, and in my opinion, I agree with Nate. Any information we get, we're going to do our best to evaluate it and consider it. So it's very different for an RFI, and I think that it would be appropriate if you have expertise in just one area and you think it's valuable for the government to know about that, I would encourage you to respond.
Okay, thank you very much.
Brian, can I add to that?
Yeah, Lou.
We recently released an RFI, actually, in response to your question, ma'am, that I'm back here, by the way. But the
He's in the very back, in the back right.
We actually asked for the businesses to respond to each element of our one solicitation at that point. It was just sources sought. And to answer your question, we allowed each of the vendors to respond independently or as a whole of each of the requirements. And we were able to then move forward ultimately with doing a solicitation. But to answer your question, we were able to look at those who only answered one part of our RFI.
Can't hear you.
Can't hear you, Denise.
He's going to give you a microphone so everybody can hear you.
I just wanted to clarify because some government agencies are receptive to this and others are not. And so I liked what I heard from Nate, but I just wanted to clarify. So thank you very much.
Okay. One more question, and then we're going to move on. Hey, Sam?
Yeah. Hi, Brian. Sam, Mohammed Ilyas from Rely Group. Question for the panel. I saw like a couple of years ago, a lot of things came out, the challenge.gov and then topcoder.com, some of the challenges and the solutions that CMS is looking for. And one that came out from that competition was the Open Payment System app that CPI has been using for providers to use. So my question is, can CMS proactively put out a lot more challenges like that outside so that, we can come up with prototypes, we can come up with some solutions and a framework, and either in the challenge.gov or topcoder, just a question, are you guys going to continue with that or not?
Don and Carolyn, either one of you kind of want to take a crack at that? Or?
Well, I think we certainly look at those as opportunities, but I'm not aware of anything right now that's on our on our radar for doing a challenge. But I know as we've worked through looking particularly in the IT area, there's some decision trees that are out of like the HHS Buyers Club and others around, looking for different ways to obtain challenges in there. But so we certainly consider it, but I don't see anything in the future right now that we have, at least in the IT area, that's a challenge that I'm aware of.
Carolyn, anything you want to add to that?
No, we in our office haven't used that. Our requirements are usually not in a prototype stage and more, whether it's marketplace or any of the major systems, so we haven't used that in our office. Not to say we wouldn't, but we haven't to date.
Okay, good. Claude, you had one thing you wanted to add?
Yeah, sorry. Back to the lady that was talking about, it's these, Deborah and I'm having trouble talking right now.
Sorry.
I'm on the spot now. It's all situational when it comes to when there's an RFP or sources sought out. It's individual. It's a standalone procurement, so everything can change. The FAR and the regulations give them leadway to do stuff. So when the example you question about, well, different agencies do different things. Well, it's they as procurement professionals need to, I lost my train of thought, and this has never happened to me before. They need to, I apologize.
That's all right. When you think about it, come on back. You can give him the microphone. It's okay.
Claude, is it that you're saying that we need to use our professional discretion?
It's that microphone that scares
It's
him.
that microphone. No, it's never happened to me before. I guess because Teresa's sitting here. That's why. It's an individual thing. So they should treat every procurement as an individual action. So when it comes to the process, they have the right to do different stuff, and especially when now I got my thought. Thank you. So when that gentleman in the back said, "Well, on this procurement, we're going to do it this way," and they want to look at the skill set. It's about the skill set. So when you're reading your procurements, like Anita said, you read the sources sought thoroughly, and if they're telling you up front that you have to do the body work as a whole, then that's what they expect up front. But if they are looking at different skill sets, because I've seen multi-award IDIQs where they were looking at individual small businesses to do certain things because they're going to evaluate the data. We'll say like they're doing a big omnibus contract. Most of my other customers are DoD based, so if they have a big omnibus contract to support a base, they would look into logistic warehousing to see where these small businesses could fit in. That's the way that they should be using the data when they get in the market research. And thank you for that challenge.
Okay, I'm glad you had a recovery there.
Hey, Brian.
Thank you for that challenging moment.
That's good. That's good. So I'm going to move on.
Can I add something real quick?
Oh, yeah, go ahead, Chip.
Real quick to that. I think maybe to summarize what folks were saying, especially about the sources sought notices, is that, we're not looking for a blank or a generic like line card, which I have seen some contractors submit for sources sought notices. You guys really need to dig into the weeds and look at the detail of what we're looking for. Read the bullet points that are in the sources sought notice and address every one of them so you can tell us specifically how you're going to fulfill the requirement for us.
Okay, I'm going to move on to the next topic. Thanks, Chip. I'm going to move on to the next topic, which is proposal preparation and submission. And I know you guys want to hear about that. So I'm just going to open it up to the start. What are CMS's expectations of contractors when responding to solicitations? And Carolyn, why don't you start on that one?
Okay, so we talked a little bit earlier about making sure your initial proposal is your best proposal. It's very important. Most times we do put page limitations on proposals. Do not use that for marketing material. That is really something that, to be honest, is a waste. You can, if you want to use a little bit, that's your discretion, but we're really looking for the substance of your proposal. You need to understand the requirements. If you don't, there's a question and answer portion in any timeline for you to come in. You need to be thorough and not make assumptions. So if you're not absolutely certain, you need to come in and ask the question, in writing, and you need to be very detailed in your response. When the panel, we have very experienced panels are reviewing these proposals, whether it be Spark, which is a huge multiple panels, I should say. And by the way, Spark do not have live requirements. Because it's an IDIQ, most of our procurements have live requirements, and the requirements are very specific, and it's at the task level. So understand the task that you are actually submitting, and your key personnel need to be the key personnel who have the requisite experience for the task at hand.
So, Carolyn, what makes a standout proposal?
Something a proposal that uses their pages wisely, crisp, to the point, understanding both from the technical perspective and your business proposal. We need to be able to track the business to the technical and vice versa. We need to understand the labor hours. We need to understand who's going to be doing what. and how you're going to be accomplishing the work. If there's ambiguity, if there are folks in there that don't really seem to have experience in the requirement, but you think that because they work somewhere before they, are good to put in, only put your people in who really can do the job.
Okay. How about you, Bridget? I think you want to add something to this one.
I can. I would add to, when you're structuring a proposal, to structure it in the same manner as a solicitation. Because when we ask for material in Section M or in a commercial contract, I believe it's a 52212-2, we will ask for information in a specific format. It's very helpful, and particularly to panels, when the information is structured in the same manner as a solicitation. We can find things easily, and we don't have to hunt for them. It takes the guessing game out.
Chip, you want to add anything?
Yeah, I would like to add a couple things, Brian. From a technical standpoint, I think what makes a standout proposal is just a very descriptive technical approach. We're not looking for a regurgitation of the SOW. Really tell us how you're going to solve the problem and fulfill the requirement for us. And from a business proposal standpoint, something that really helps us out, especially for the cost reimbursement structured contract, is provide us a thorough description of your costs. And when I say costs, I mean costs by each line item, direct labor, ODC, subcontractors, all the way down the line, because the folks that sit over in OAGM that are doing the business proposal evaluation, we need to understand where your costs are coming from and exactly what they are and how they're justified and how we can determine those costs to be fair and reasonable.
Okay, good. So let me ask...
Brian, can I add one thing, please?
Oh, yeah, sure.
Thank you. When Carolyn spoke about the question and answer period, one of the things I want to bring up to small businesses, I know you know me, but don't call me to ask the question about the RFP. Put it in writing to the CO. You can copy me, but I can't give you the answers. So some of you call me, email me, and you don't email the CO. You're missing an opportunity for an answer to your question.
Okay, so I'm just going to canvass anybody on this one, and I think Carolyn kind of said it. What makes a great standout proposal as opposed to acceptable? Does anybody want to chip in on that one?
I'll chime in, kind of backing on Chip's comments. From a business proposal perspective, being able to see the answers to my questions as an evaluator. If I'm looking at another direct cost, and it's for an item or a group of services or whatever, and there's an amount there, and if I can go to some narrative that explains very detailed the basis for that cost, such that I have so much confidence that it's well supported and therefore reasonable, I can move on. Without that support, I'm going to question it, and I may arrive at a conclusion about that cost that's different than you wanted me to arrive at, and I may make a cost realism adjustment.
Yeah, and so kind of to encapsulate a lot of the comments here, which are very good information, hopefully, that you feel like you're getting. You really need to put yourself, when you're writing a proposal, in the position of a person who's reading it. So it's going to be submitted to CMS. There's going to be, well, if it's a sole source, there's going to be some kind of a panel, even if it's a sole source. Usually they're competitive. And you have to put yourself in the position of, I do or don't know this company, it really is irrelevant. Here's the requirement, here's what the government asked for, here's how I'm responding. They're crosswalking things and not making assumptions and making things as clear and crisp as you can is really golden. Because when a panel has to struggle and has to caucus for hours, which happens, on does this offer understand it? I'm not sure. The panel's split. They don't know. Then you haven't done a good job. It really needs to be something that where you can put yourself in the position of people who are reading this to understand, okay, if I say this, and even have other people in your company do it, if I say this, what does that sound like? What is it? Is that clear?
Okay, I'm going to go on to one more question, and I kind of really like this one. I'm going to skip one. And Dan mentioned we have a lot of IDIQ contracts, and you hear that, around the federal government as a whole. But the question is, if the company I work for and represent did not propose a sub or a prime for an IDIQ contract, such as Spark, is there potential future subcontract opportunities under task orders? So I'm going to start with Don. You want to pipe in on that one?
Well, certainly are. I think as we've indicated through the conference this morning, all of our IDIQs we publish, and whenever I meet with contractors who maybe aren't already doing business with CMS, I'm quick to try to share the list of contractors that are on our IDIQs. We also do work, particularly in the IT area, with some of the GWACs, so those contractors are well known if you go to those websites. Basically, at any of the contract task order levels, when we go out with a request for proposal, there's opportunities for that contractor to add different teaming partners for response to that particular requirement. So there's definitely opportunities, even if you didn't propose as part of the initial team on an IDIQ, to obtain work as a subcontractor.
Okay, anybody else? Anybody else want to add to that?
I would add that as IDIQ holders, because the dollar values are normally over $750,000, which requires them to have a small business subcontracting plan, they're held to that plan. And the way they're held to that is it's a criteria as we evaluate their performance using the Contractor Performance Assessment Reporting System, CPARS. So it is an important element of performance. They're graded on it. So they're motivated, so let them know you're out there.
Okay, good. With that said, I just want to open it up. Any questions from the audience? Kathy up front. Somebody have a question right up front here?
In some discussions with OTS, a comment came up about, and this is in a prior forum, the comment came up about trying to put on the technical evaluation panel people who really understand technology, because if you're planning to bid something innovative in an industry that might not be something CMS is doing, but it's commercial best practice. And so they were talking about trying to staff the technical evaluation panels with people who are experts in that technology or service, whatever. And then just recently, HHS talked about a whole new job series that's going to combine acquisition and IT specialists together. Again, getting at, making sure that the people that are evaluating have the expertise of the technology. So my question to you all is, are you starting to see that being incorporated into the technical evaluation panels, or is that a future thing?
All right, so there's a lot of questions in there. So let me start with, and since it's OTS, you're specifically asking about, is that me? Sorry. Okay, I'm technologically challenged. So when we do a number of procurements a year. We do probably between 22 and 25 procurements a year, and we're moving a lot of work. The technical requirements, the folks who staff the panel, whether they be, most of them are inside OTS, but a lot of times we go out to the business components and ask them to be on panels because we represent the business. That's, we're a service organization. Those folks do have knowledge of the requirements and of the technology. If a contractor or an offeror is proposing something that's new, innovative, different, that it has not been asked for, that could be considered an alternative proposal. So I just need to say that you need to make sure that all requirements in the original proposal are responded to, and then anything in an alternate approach is labeled as that if that's what it is, whether it's commercial or cutting edge or whatever. So that's one thing. The job series, I don't know. I'm not in HR. I can't speak to that.
I can't say we've seen that here, but what I will say, I think in terms of best practice, we try to work hand in hand with the program office and have acquisition people, sitting in with the panel. So, I don't know whether you want to call them something one way or another way, but I wouldn't say, I don't see, Dan, any thoughts on that one? No, I wouldn't say there's any thought on that changing here. Okay. Another question, please? This is for you.
Thank you. Good morning. I'm Whitney Owen from LMI. You talked a little bit about how you determine if there's a small business in the marketplace that can do the capability through sources sought. We've kind of seen a trend across government to go to more small business, and not just in CMS, but in other agencies and departments. It seems that larger and larger requirements tend to be going small business. And there certainly are really good requirements that a lot of good small businesses can do, but there do seem to be some that go to small business that the program office may not think a small business is the best choice. So I'm curious if you could talk more about how involved the program office is in determining when something goes to small business and how you choose that?
Yeah, it's a great question.
Let me take a shot, since I'm a program office. So Don will vouch for me. We work hand in hand with OAGM. We're very involved on every single procurement because it's our requirement of if we think it's small or it should go unrestricted. We bend the curve, I will tell you, in OTS in the amount of small business contracts that we award. We exceed every percentage there is. So we are good at that. Sometimes, as you said, there are requirements that need to go unrestricted, and we have conversations. We have very thoughtful, long conversations with OAGM, and we always come out, we may go in with different positions, we always come out with the same position. So that is not taken lightly, I can tell you. There's a lot of prep work for every RFP, and my philosophy is you can't start too soon on a procurement because people say, oh, we can do it quicker. No, you really need to do it thoughtfully. So we spend a lot of time in the planning stages and in the discussion phase stages, and we make every single one of those decisions based on the actual requirement that we're procuring.
Anita, go ahead.
Just to add to that, so you know that all the responses that come back to source of salt notices are provided over to the program office to assess those responses. So it is a collaborative between both the contracting office and the program office, but there are technical people in the program side who review those responses and assess the capability to be able to perform the requirements.
Go ahead, Anita.
It helps to have me here. Ultimately, CMS has to meet their mission. That's number one. But me not being a CMS employee helps me to be able to give a little pushback. So I have to have you all help me do that. So the number of responses and complete responses showing your experience and your teaming partner's experience to similar or like projects that they're looking for on the sources sought, that helps me. Teresa talked about fighting the fight. If you don't respond adequately, I can't fight for you. So when I need to fight, I do. And what I do when you respond, I'm looking at your responses. I'm looking at the program's write-up to the capability statements and whether they feel they're capable or not, the small businesses, and whether we should set it aside. And mind you, I'm a lay person, I'm not the technical person, but if I disagree, I go back and I ask questions, and hopefully we can come to the table in an agreement and make collaboratively that's best for CMS, but sometimes best for small business too.
And Anita, just talk, what happens after you say it's okay, then what happens?
It goes to Claude. And then after Claude, let's say it doesn't, CMS says, we're not setting it aside for small business. If I agree or I don't agree, if I don't agree, we try to correct that in-house, come to some kind of a consensus in-house. If I agree, we come to a consensus, then it goes to Claude. And I've usually already brought Claude in along the way. If I'm having a problem, I bring him in early, so that we're all on the same page. After it goes to Claude, let's say it's not being set aside for small business, then it goes to the OSTABU director's office, and either Teresa or the deputy director of the OSTABU office will review that. If I'm in disagreement with CMS, I'm already talking to them, giving them a heads up, so if they have to intervene. But I can say most of the time, probably 99% of the time, it's settled inside CMS.
Okay, thank you. And she is a great advocate for small businesses. We have lots of nice discussions with Anita from time to time. Anita knows everybody in our office, and sometimes we say, oh, we have to see Anita, because she does fight for small business, and we do appreciate that, and we have a good working relationship, but it can get heated sometimes, actually. So I want to move on to the next set of questions. I think they're pretty important. And I really want to ask this one because I'm really curious what everybody's going to say, and hopefully you guys will have some follow-up. But how does a contractor best communicate status of performance, whether good or bad, in a manner that ensures this information is known by the program manager? So Carolyn, I'm sure you have a lot of experience with that.
So we all hope things go well, right, in our contracts. You do, we do, and sometimes they don't. The important piece is, so when any contract's awarded, we have a kickoff meeting. At the kickoff meeting, it's very important that you as a contractor know the players. You will obviously know the contracting officer and contracting specialist. You need to know the contracting officer's representative, who they are, and the government task lead, because you need to be going in through the proper channels. In addition to that, depending on the severity of the issue or the issues that, that are happening on the contract, you do need to know the chain of command and the line of communication within all of those towers, if you will. So don't struggle with things alone. We do pay you to give us what we want in the contract. We do expect professionalism and expertise that you're bringing to the table. Things happen in life, there are problems, you need to communicate that first to the Corps and GTL and the contracting officer. When that, and this happens, and it happens more than it, probably people would like to admit, we have complicated systems. We have very complicated systems in Medicare and Medicaid and CMS, and it needs to be brought up a level. You need to make sure you know who is in that chain of command and that there are no surprises. So just like when you have employees, and you're giving them reviews, they may like it, they may not like it, but they should never be surprised. That's what we say in the government. We never want to be surprised. We never want to find out things through serendipity. We never want to find out things that you didn't come to us directly and tell us, because everything can be worked out. It might not be the best way or to one party's satisfaction as much as the other, but we need to know, and we will work through it.
Okay. Don, you want to add something to that?
I think Carolyn hit a lot of the key points as far as understanding the right players on your contract. Certainly we have a wide variety of contracts here, from small to very large. And if you have a very small contract, you still need to make sure that you know who the key people are. You should be communicating with the Corps and the contracting staff. It's kind of concerning if we hear a contractor say, I don't really know who my contacts are at CMS. So you have an obligation as well. We do go out to try to make sure that that's known through kickoff meetings and other things, and obviously your contracts identify those people as well. So, it's very incumbent on you to develop those relationships with those key contracting people and program people at CMS on the contract that you have. I'd also like to say that your success is our success. So as we said throughout the day, we rely on contractors to get most of the work that we're doing for CMS accomplished, and so we're not here trying to slam contractors, say you're doing poor performance. I mean, we're here trying to make sure that you're successful, so that makes us successful. I think it's all about, communicating frequently. I'd like to hit on the bad part, I guess, because bad news doesn't get better with time. So it's not really in the best interest of a contractor to try to, mask something or not really disclose something. So as Carolyn said, we know that those things happen. It's we have complex and challenging projects and contracts, and we will hit some hiccups and road bumps along the way. And it's about a contractor coming in and identifying how they're going to fix that. So again, we're looking for contractors to come in if there are problems, identify to us. You have solutions, you have ways to fix those problems. What's your corporate commitment and backing to come in here and then fix the issue or get it corrected? So I think it's really key to identify problems early on, identify them to the right people, and understanding how you can escalate those things within CMS. So understanding, as Carolyn indicated, who the right players are, but then who their managers are and what the right chain is here at CMS for communicating, depending upon the severity of the issue that comes up.
And I'd like to add one point to that, because sometimes Don and I are in a situation which is infrequent, and folks are like, maybe I'll go to the office of the administrator and tell them first. That is never the right solution. If your chain doesn't know, and they just go in and just because they're just having a conversation, they thought they'd have a chat. FaceTime's interesting. It may be good, it may not be good. Be careful what you wish for. Don't circumvent the process and go to folks thinking, well, I'll get a little FaceTime and tell people what's going wrong. We hear it. We probably hear it 3 to 5 minutes after you leave the room, depending. And they understand from our point of view, of course, they always want to know, well, what's going on, and we tell them and deal with that. So you do want to make sure you go through the chain, and, skipping a few levels initially is not advisable.
Okay. Any other final point? And
I just wanted to tie this concept to our first one, and that's something that we look for a lot of times in source selection, is an ability to overcome problems, to identify them early and come up with a solution. So I would always try to look at those as opportunities for your next bid. We had this come up, we were able to solve it, because that's stuff that we're looking for in past performance. And I just wanted to connect those.
Okay. I think I'm going to cut it off here. I think we have the administrator ready to go. So I'm going to cut it off, and I think after that we're probably going to break for lunch. But we thank the panel members for your participation and honesty, and thank you for your questions. Everybody, Dan. They said they were going to leave them. You want us to move them? Okay.
Just give us a few minutes for some housekeeping. Just a couple more minutes. Okay, I think we're connected. I understand Andy's looking at us. Andy, are you there? So, by the way, Andy is he's remote today, so he's like we all are, remote administrator, remote working. Are you there?
I'm here.
You're there. Okay. Well, we can hear you. We can't see you, but we'll try to work that out. So I know our time is short, so I'm just going to do a quick introduction so Andy can get started. So I just want to say I've known Andy since 2012 in the fall. There was some things going on here at CMS, and he kind of raised his hand and volunteered to jump into the fire and maybe even work with some of you out in the audience here to come in an environment that he's never worked in before, in government contracting environment. And so I've had some personal experiences working with him, and he's very respectful to the process, the procedures, but also he's very focused on getting the job done here at CMS, and people that work here really appreciate that. You can look him up online. I don't want to go into a lot of his bio, but I can say that, you know, he's had a lot of experiences in his career, and he is very passionate about health and health care and the well-being of American citizens to get good health care. He also lives in Minnesota, and that's why he's not here with us today. He's in D.C. most of the time. He actually commutes to Washington back and forth, and that's why we're hearing from him. And he really wanted to speak to you today, and so that's why we're hearing remotely. Oh, and there he is. And yeah, you did put on a good sweater like I asked. You're looking good. Okay, Andy Slavitt.
Thanks, Dan. Thank you. So you all will let me know if, for some reason, you can't see or hear me, particularly hear me, since I think we can get the job done without you looking at me. But I'm very, very pleased to speak in front of you today. And I also just want to take the opportunity, which I don't get very often, to commend Dan and, in particular, the work of his team, who I think run one of the most professional and complex operations. It's not doing, managing the relationships with our contractors at CMS is not at all like it is anywhere else. Because as I'll speak about in a moment, you all have to be extensions of us and the work that we do. And therefore it is both a critical process with lots of oversight, but also a process that we need to do very carefully and respectfully so that we can be productive together. I'm going to talk about a couple things this morning, and I'm very eager to be in front of you because you are, in effect, our what I would call our other workforce. I get to talk to our workforce all the time, but very rarely do I get to talk to you and your teams. So I'm going to talk about our priorities so that you understand where we're going. I think CMS is in a unique position with a unique set of opportunities to lead and change in healthcare, and I want to make sure you understand what those are. I'm going to talk a little bit about relationships and our relationships with all of you and how I look at those and how important they are. And I'm going to talk about the challenges we face together and what I really need from you in order to make us as successful as we need to be. And I think if I would leave you with anything, I would say as good a work as we may be getting from contractors today, the bar is going up, and it's going up pretty rapidly. And I want you to walk away with that message and an understanding of that. But first, I just want to say thank you for all the good work you do for us every day and over the years. You know, the orientation that we all have at CMS and that we talk about every day are really around two important people: our beneficiaries, the consumers we serve, and the taxpayers. And, you know, what I would want you to have, the image I want you to have in your mind is that there are 140 million people who count on us and our programs, and many of them are in a situation that all of you have been in your lives, where you have a loved one in the hospital and all you care about is having that person come home, feel better, and resume their normal lives. Where you have to put a parent in a nursing home and you want the best information possible, so you make sure you're giving your loved one the quality experience they can. Or you're in between jobs and you're trying to figure out the best way to get coverage for your family. So there's a whole wide variety of beneficiaries we serve every day, and we do it with very limited number of people and resources, but that is our commitment. And I think to everything we do, we and you always need to be asking yourselves the question, how is this going to affect our consumers, our beneficiaries, our customers? Second, the taxpayer. And in a given year, a working American is going to pay thousands of dollars to CMS to make sure that our programs are working for them successfully today and are available for them when they need them in the future. And so that's the second question you should also always be asking yourself, is what you're doing giving the taxpayer what they need in an incredibly resource-limited environment where we are increasingly soaking up a lot of the dollars federal government level. So let me talk about our priorities, and I'll talk about them in sort of three levels. The first is leading the healthcare system through what is an enormous amount of change. And what do I mean by leading the healthcare system through an enormous amount of change? So I'll talk about the change at two levels. There's a set of changes that consumers face now that are relatively unprecedented. Many are getting coverage for the first time. Many of them are trying to figure out how to access care. They're growing older. They're in sandwich generations where they're taking care of new sets of parents. And this is a problem we have talked about, the problem of the uninsured, ever since I've been in healthcare, and anybody I know has been in healthcare. And up until 5 years ago, we never made a dent in it. And today, we're really making a dent in the problem of the uninsured. But that's an enormous set of changes for people, and we have to help them find what they need. And if you remember, to any other aspect of your life, the consumer experience is far better than it is when you're in a healthcare situation. So that's one of our obligations. The second area of change we're leading is for the people who provide the care, the people who are delivering healthcare services, doctors, hospitals, nursing homes, home health organizations, that whole delivery system. And the way it works today, it works in a very siloed fashion where organizations don't have the information they need, they don't have the incentives they need, and they don't necessarily have the support they need to provide an experience that's centered around that individual. And that has to change. And if that doesn't change, the taxpayer is not going to get their money's worth, and the consumer is certainly not going to be happy over the long haul. So we're trying to lead that change, and CMS is an important part of that change because, let's face it, we pay for the care for 1 in 3 Americans. So we made a commitment this past January that we were going to reach a point in the next several years, by the end of 2018, when over half of our payments were linked to quality and value, as opposed to today where they're just essentially fee for service. So that's an enormous commitment on our part and takes a tremendous amount of work and a tremendous amount of change. And we have to release new payment models all the time, make sure that they work. And then, of course, we need to make sure that we can make sure that they work in the system and that the infrastructure works successfully. So as you think about the work you do for us, helping us to drive that leadership and that change is important. The second area, as I mentioned, there's 3 areas I'll talk about. Second area of priority for us is then giving the people in the healthcare system the tools they need to thrive amidst all that change. That means we are giving grants to provide healthcare practice transformation to physician practices. It means we are creating rules to support the use of new technology, like meaningful use, which is a way of incenting people to adopt technology. It means we're releasing data so that people can understand how the practices, their physician practices are performing, and it's releasing information to consumers so they have the tools to make good healthcare decisions. But this image of CMS as a policymaking part of the government alone is completely wrong. For those of you who know us, and as you think about where we need to be in the future, this second priority is really all of our operating tentacles to make healthcare succeed, whether it's the tools we talked about or many of the other things that you could be involved with, like ICD-10. But we're helping to lead an enormous amount of change, and we need many of you to help us do that. And the third area I would point to as a priority is really how we at CMS develop our own culture, our own infrastructure, and our own performance, which means in order to do the things we just talked about, create change, provide tools for people, we ourselves need to be performing at an extremely high level of execution. Whether what we're talking about is a healthcare exchange, whether what we're talking about is a new payment model, we are going to be driving things that have never been done before, and we're the ones doing them for the first time. So think about that, a government agency leading the path to execution. It's pretty exciting, and I think it's allowed us to attract an incredible workforce who's incredibly committed, but it means culturally we need to be very, very focused on a few things. Solution orientation, very adaptable. We need to be continually able to move the needle and push forward. We need to be great at busting silos so that we can work together across complex solutions. We need to provide the best tools to our own team, and then we need to keep, most importantly, we need to keep that consumer at the center of everything we do. So this is evolution of any organization, just like your own organization. We too have to evolve. So as you think about all three of those areas, leadership, operating support, our own culture, these are areas where, to the extent that you understand us or you want to understand us and you want to build long-term relationships with us, where you can help succeed. So how do those external priorities change that are changing healthcare impact what we need from you? Well, for one, it implies we need a lot of innovation. So for example, how a claim is paid, if you're a Mac, today, versus how a claim will be paid and should be paid when it's based on performance, you can imagine the type of technology and the type of data and the type of capabilities we would need. But there are other examples. How we use data, how we analyze data, how we display information to consumers. There's sort of a whole host of things that we're going to continue to need, and we need people to show up who want to help execute extraordinarily well and drive change. And as our world changes, and the world that's changing around us, I think it's important to step back and look at how that impacts our demands and our needs that Dan and the team have when they talk to all of you. I would remind you that while we are taking care of 140 million odd people, there's only 6,000 employees at CMS. Now, one might say, gee, that's kind of not a great way to run a railroad, to have 6,000 people have to take care of 140 million people. However, the place that has to then work, and what has to make that work, is all of you. Because we have, between 80 and 100,000 of you that have to really function as an extension of us. And so I think you're going to see that, and I'll talk about it in a minute, having the ability to understand our goals, our needs, and execute in a way with our clientele, our consumers, our provider base, that is an extension of us. It's going to be what it's all about, and it's quite frankly going to be what we're going to demand. So if your orientation as a contractor is one where you're focused on how big are the awards and how many awards and so forth, you're likely to have a shorter life with us than someone whose full focus is a long-term partnership, who really understands us and who wants us to exceed on these goals, because these goals are very ambitious. I would also tell you that something impacting your world and ours is the, I think, emergence of a new class of vendor, both in the technology space and in other spaces. We've now been able to run projects to build really world-class technology in what normally would have taken us years over a matter of months, and what would normally cost us tens of millions of dollars or even hundreds for single millions of dollars. We have a new entity called the U.S. Digital Services that is really accessing and providing very high quality resources. So the challenge for all of you is what may have worked last year may not be what works next year. And so I would ask you to constantly challenge yourselves how to do it better, how to do it faster, how to do it cheaper, how to bring more innovation. And so the threat is, the status quo is under threat, as I think it always is. Finally, let me just end on a note which helps you understand how I think about the contractors that we work with. And as Dan said, I've worked most of my career in the private sector, so worked with a lot of companies. I've been a vendor to other folks, whether it's in the government or outside. And, you always try to describe yourself, or would love to be seen by your client, as more than a vendor, as a strategic partner, or some other buzzword. But fundamentally, you're striving for something more. But the question is, what are the words? What are the meaning behind the words? So, in my mind, I sort of classify the world into, there's really three types of contractors that we deal with. You call them, an A, a B, and a C. To me, a C contractor, someone who does a C job, is someone who performs. They get the job done most of the time. Occasionally there are issues, there's challenges. They wait for us to tell them how we want things done more often than not. And if there's things that we need, like, we need, like, I'll pick an important example, cybersecurity standards increased. We have to get, very, very picky and into negotiations, and everything has a trade-off, and we end up at a place where we get there for sure, but it takes us the maximum amount of time, and it's not very nimble. A B contractor, to me, really does the job, does the work, usually does it well, and does it within budget. They're compliant. There's no issues or concerns. Things go reasonably well, and that's probably I'd say maybe even the vast majority of our relationships. So what's an A contractor or an A vendor for us? An A contractor brings solutions to us within the scope of their work to solve problems in ways that we haven't seen and we haven't anticipated. Anticipates problems. I can think of one now who saw a problem that we didn't see. When we talked to them about how to solve it, they already had solutions baked in. When we talked to them about the budget, they said they found parts of the budget they could recommend reducing costs in so that they can do this without having to deal with it, and they'd already found high quality resources. The A contractor always has the best people in the organization. They're innovative. they're fast, they're collaborative, they care about our priorities, they want to understand the things that necessarily impact them every day, but impact us and our constituents so that they can be ahead of the curve. They communicate exceptionally well, and their organization is dedicated to delivery and execution and accountability. They admit when they've made a mistake and they talk about how to fix it. So, and I would say, by the way, the same might be true for us. There might be occasions when we are a C client or a B client or an A client. And if we want to work with A vendors and contractors, we need to behave like an A client, which means openness, which means we share information, which means we are badgeless and we treat your teams well, which means we are open and honest and move quickly. And we know that we're not always live up to that, but we strive to, and we need to, because we know that those things go hand in hand. So, you know, in this parlance, there's really no room for C contractors in CMS. B contractors, we need to take the bar up, or eventually they will be replaced with good competition. But we also know that we can't expect you all to get there unless we help. And we're committed to doing that. And I think the investment, the open door policies, the communication, all of the innovative things that Dan and the OAGM team lead to reach out to all of you are really an effort at doing that. And we need to do it better, and we need to do more of it, because we know that in part we get out what we put in. So with that, I want to get you back to your conference. I really appreciate you taking the time to just hear a few of my remarks. And I want to thank you for helping to take us where we've been. Let you know that my remarks are based not on any desire to be tough, as much as the fact that the demands on us have been ratcheted up so high, and we need to ratchet them up on each other, but we're going to get through it together. So very much appreciate that, and I'll give it back to Dan.
Thank you, Andy. Thanks for taking the time out of your busy day to talk with us. So I think we have lunchtime now. Is that right? So what time are we back? I'm looking at Brian. 1 o'clock. So be back at 1 o'clock for your breakout sessions. Thank you.